Right now, the Knox County Health Department is reporting a rise in whooping cough, or pertussis. That's a respiratory tract infection which can put babies at risk. 10 News reporter Krista Lucas shares how to protect yourself and the people you love.
It all starts from feeling unwell. Dr. Megan Edwards from the Knox County Health Department says this infection turns into a bad cough for babies.
This year we've had more than 30 cases, which is 5 times more than we're used to seeing in Knox County.
This cough is different.
Whooping cough is classically that deep inspiration after a cough. It is a prolonged cough, usually at more than 2 weeks. It used to be called the 100-day cough.
It can be dangerous for infants.
What's most scary is that tiny babies who get whooping cough will stop breathing.
Dr. Edwards says the best cure is prevention with a vaccine.
Nearly all of the cases that we've seen have either been unvaccinated or under-vaccinated, so babies who hadn't been able to complete their full series.
She says Knox County has high vaccination rates.
But in those pockets where the vaccination rates are lower, that's where we're seeing higher cases of pertussis.
Age 2 months is the earliest you can get vaccinated.
But pertussis vaccines are some that you get over your lifetime because we know that the immunity changes.
In Knox County, I'm Krista Lucas.
Experts do recommend that anyone who will be around a baby should get vaccinated. That can help prevent against whooping cough. The Knox County Health Department is going to be launching a back-to-school initiative later this summer so that children can get vaccinated quickly.